Hello, Dr. Akar.
Hello, welcome, Maria. How are you?
I'm very good. Could you tell me, please, what kind of methods for hair transplantations you use and why?
Yes, we are using the FUE, which is advanced in hair transplantation, but we are combined with the DHI Sapphire method. So, for example, we are taking the grafts with the classic FUE method from the backside. But the important is in our clinic we are especially very focused on the natural hairlines, about the density and about the success rates in the hair growth. So that's why we are combining the sapphire blades, which are micro sapphire blades. We are using extra small sapphire blades plus the implanted painting.
Could you show implanted pen,
Yes,
if you
of
don't
course.
mind?
So we have different sizes or different graft thicknesses. For example, we are designing the hairline. The hairline is very important. We are designing the directions of the hair growth, and after then we organize the density. At first, we are open with sapphire blades. Here the small incisions. We are organize the hair growth direction, the angle, and the density. After the incisions are finished, we are putting the hair follicles one by one in these small implanter pens. So the implanter pen,
It's really small.
it's very small. It's just a little thicker than a hair. Why we put it inside? It's really protected during the implantation. And then we are putting the grafts in the pre-made incisions gently, softly, and the grafts get a higher success rates.
And what is the success rate for the DHI method for
For
grafts?
DHI method is very close to 100%. If you make everything right, if you make the extraction right, if you keep the storage in a good quality, and if you put the grafts correctly in the pen inside, and if you implant them correctly, it's very close to 100%.
Okay, and what kind of method would you recommend for the patients mostly, FUE or
I
DHI?
recommend, to be honest, I recommend for patients in our clinic, because we are following the results. We have patients from all over the world. We are following the results very closely. I recommend the DHI Sapphire method.
And what is the advantage of sapphire?
The sapphire blade is a very sharp and very precise made stone blade. It's a very precise, very special stone blade which have a special diameter, special depth, and the cutting quality is very high because we do thousands of incisions.
So the healing is more fast, right?
Yes, and the healing is more faster. And if you look on the shape is like an arrow on the sapphire blades. It's like an arrow. So that's why the damage is less on the blood circulation. That's why the healing is faster.
Okay, and how long is the healing process with DHI sapphire method?
The healing process is about 1 week. But the important is not the outside healing for us. More important is the under the scalp healing, what we don't see. This is more important. The under the scalp, under the epidermis, the healing is more important, and especially the advantage on sapphire, the arrow tip sapphire blade is on the under the skin, what we don't see, but which affects the result 100%.
I see. So in order to reach 100% result and the hair stay, we need to use DHI sapphire method, right?
Yes, sapphire
Which-
blades, but there are different sizes of sapphire blades. There is big sapphire blade. If you use a big sapphire blade, you don't get the advantage of the sapphire blade.
I see.
The sapphire blade must be in the arrow shape and as small as possible. So small, so less damage, so better success rates.
And when the patient can expect the result of the hair growing?
You can patients can see the results after like 6 months to 18 months.
Mm-hmm.
6 months to 18 months is change. It depends on the body support, but we see this microcephaly blades early results very well. We tell like 6 months to 18 months.
Mm-hmm. And is there a big risk that will be after the procedure, the hair will be lost in 1 or 2 or 3 years again?
Transplanted
same.
hairs,
Mm-hmm.
if you take it from the right donor area,
Mm-hmm.
it stays for rest of the life.
For the rest of the life, so it will
Stays
not
for
be
rest
lost.
of the life,
Mm-hmm. Okay, and do you regularly see with your patients some kind of complications after the procedures?
We don't see any problems, any complications. We give all the medications what the patients are needed for aftercare, and we stay in contact with patients online,
Mm-hmm.
and we don't see any big complications, any problems.
Okay, great. Thank you very much, Dr. Akar. It's very
Thank you very
nice
much. You're welcome.
to speak
Thank
to
you
you.
very much. Thank you.